Hi, I'm Malika Sharma. I'm a CTN CanFAR postdoctoral fellow working on a project this year with Dr. Daryl Tan around building healthcare capacity and patient empowerment through patient-initiated continuing medical education around HIV pre-exposure prophylaxis. Basically, we know that HIV rates continue to rise in Toronto and in Canada more broadly, and we now have a number of HIV prevention tools at our disposal, including the use of HIV medications to prevent HIV infection, specifically pre-exposure prophylaxis. One of the big issues with pre-exposure prophylaxis, however, is that right now PrEP delivery or care is really centralized. So for a person to get onto PrEP, they typically have to be referred to an HIV specialist, wait the time that it takes to get into a specialist's office to see them, and then the process starts from there. We know that what would probably make a lot more sense is for people to be able to access PrEP through their primary care providers or their family doctors, or through sexual health clinics, through nurses, for example. So our project is really trying to expand access to PrEP by decentralizing it through those two means. One, through nurse-led PrEP at sexual health clinics, and by empowering and educating family doctors on how to deliver and prescribe PrEP safely. So our project is going to be disseminated throughout Toronto specifically, using cards that are disseminated through community-based organizations to people who are predominantly men who have sex with men right now, who access community-based organizations and other gay men's health organizations in Toronto, as well as online through applications like Grindr, for example. So it's actually hard to know exactly how many people will be interested in this project based on their use of the cards, both electronically and the paper copies. Our hope then is that people who or participants who take these cards will actually go online to complete an online module that's self-education around PrEP, whether they would be a good candidate for PrEP, what PrEP means, how it works, what they would have to do to be on PrEP, and also gives them some pointers or advice on how to engage with their primary care providers around accessing PrEP. We then ask them to take that card to their family doctor and have their family doctor actually do continuing medical education that is accredited and is informed by Canadian guidelines on the use of PrEP, so that they themselves can become better informed. The hope is that that interaction also facilitates a subsequent dialogue around PrEP and sexual health more broadly, and hopefully results in actual PrEP uptake. We're hoping to start this project in January 2017 when our online modules will go live.